Good evening, everybody. Welcome to the meeting. So the first item of business is election of chair for the new municipal year. Is there a nomination, please?
I'll nominate Beth.
Microphone.
Sorry. I'll nominate Beth Rowland.
Is there a seconder for that? Are there any other nominations?
No.
Okay, congratulations, Beth. You're in the chair.
Looking for next month, not this month.
Appointment of vice chair. Do we have any nominations for vice chair? Oh, sorry. That's all right.
I don't know who wants to be vice chair. Do you want me to be?
If you want to be, that's fine.
Okay, then. All right.
Do you want to be? Yeah. It's better than when I got nominated for something, but I didn't even know I was nominated for something.
I'd like to nominate Adrian Mather.
Thank you.
Well done, Alison. Can we have a seconder, please? Thank you. Michelle?
Yes.
Mike?
None received, Chair.
It's so long. The minutes of the previous meeting, item 4, page 5. Any objections to the minutes being approved? Are you happy that I sign them as a correct record of the meeting? Thank you. Can we have a show of hands, please? Thank you. Any declarations of interest? No, thank you.
No public questions and no member questions, Chair.
Lovely. Page 11 to 16, Royal Berkshire Foundation Trust Strategy Refresh. Who have we got from the hospital? Oh, hello, thank you. Thank you, both of you. Would you like to go ahead, please?
Good evening. Suggest we do some introductions first before we kick off. My name's Rebecca. I'm the Associate Director for Strategy and Performance at the Royal Berkshire NHS Foundation
Can I
Trust.
stop you, Rebecca, because we can't hear you very well. We're just trying to adjust the system.
Okay, let me see if I can get closer to my laptop. Is that better?
That's better, thank you.
Okay, I am shouting slightly, so I'll just pull the window too. Hello, everybody. My name is Rebecca. I'm the Associate Director for Strategy and Performance at Royal Berkshire NHS Foundation Trust.
Good evening, I'm Andy and I'm Chief Strategy Officer at the Royal Berks.
Oh.
Brilliant. Okay, so good evening, everybody, and thank you for having us here at Wokingham HOSC today. We're really pleased to be talking with you today as part of our work to refresh the Royal Berkshire NHS Foundation Trust, or RBFT's trust strategy, which will guide our strategic direction as an organisation for the next 5 years. So as you can see in the paper, our current strategy was last revisited in 2022, and we're looking at it again now with changes to our healthcare landscape, with integrated care boards and systems now in place, and also the national NHS review that's underway following the arrival of our new government last July, which will include the Darzi independent investigation and also the 10-year plan that we're expecting to come out later this month. So as you can see, we're now in the engagement phase of this work, which is why we're here today, and we'll be running that from March through July. In the paper, I've shared some highlights from the previous phase, which is the planning and exploration phase, which may be of interest to the committee. Over the last few months, we've reviewed our progress against our current strategic objectives and ambitions. We've looked at over 50 national, local and regional policy documents, and we've also listened to our staff across the trust about what matters to them as part of our regular What Matters engagement exercise. So our strategy refresh has provided us with an opportunity to look at what's working well, what needs to improve, and what new priorities we should be thinking about for the next 5 years, especially as we work increasingly more closely with partners across the system. So in our engagement, it's really important to us that the strategy is shaped by the patients and community that use our services, the staff and the volunteers of our organisation, and also our partner organisations. So I suppose that includes HOSC committee members, both as representatives of the local community, but also as partners in how we design and deliver care. So for our discussion today, we'd really like your input and your recommendations for what you think the RBFT strategic aims and objectives should be for the next 5 years. In the appendix, I have a list of our current strategic objectives and aims, but please don't feel constrained to those and feel free to comment outside of those. So unless Andy has anything to add, we would love to hear from you.
Thank you. That was very short and sweet. Do we have any questions, please? Rochelle.
When are we going to get a new hospital finally for the Royal Barbs? Because it's way overdue, and every government seems to be pushing it further and further away. And having people actually stay in hallways and stay in closets or something like this is a disgrace in this day and age.
Yeah, thank you for your question there. I mean, a new hospital would be absolutely at the centre of our agenda. As this group's probably aware, as you say, we've been pushed to an earlier start of construction of 2037 as a result of the most recent announcements. And we're having to pause our work on the programme because of that and the funding profile. It is something that I've been giving some thought to about what we can do together as a community to try and firstly make good on that promise, but actually more importantly bring it forwards. I think it's a really tough challenge given the state of the government finances at the moment. But it is something we're giving attention to, and we're seeking kind of input from this group and others about different ways in which we can make that more of a reality more sooner, more quickly. But it is at the moment a long way away, and we did. Just for benefit of clarity, we don't have patients in corridors in our hospital. That's partly it's mainly down to the work of our staff, but it's also because our corridors aren't big enough to have any trolleys on. So sometimes the ageing estate means that we're kind of avoiding some of that care that we shouldn't be providing to patients.
Adrian.
Yeah, I don't know if the microphone system is working properly now. Thanks for coming to show us again the strategy. I think the core strategy wasn't wrong previously and is right now. I wanted to continue the discussion point, which was around new hospital. I looked at, I know the CFO, Nikki, is leaving or has left, and I read the announcement from Steve, and I think in that it mentions that, over recent years, something like £300 million has been spent on maintenance. I think it was in that communication. I could be wrong. But what the point I'm trying to make is the same point I tried to make last time, which is that because Royal Berks is 46 or so decrepit buildings, the maintenance cost is enormous. And moving to a new hospital, the interest payments on a significant loan of 1 point something billion would probably be less than the maintenance cost over 10 years or 15 years or whatever it's going to be. So my question is again, is there any other route of financing a new hospital and therefore circumventing the need for 13, 15, maybe longer years of maintenance of these old buildings? Thank you.
So Adrian, I think the £300 million number is the calculation that we've done about the additional costs of the delay as a result of further falling further behind on the backlog maintenance that we have got already over that time period. As we sit here now, there isn't another route to financing it other than the government's programme, but that is something we continue to look at, because anything we can do to bring the hospital forward, the better. But at the moment, routes for hospitals borrowing money are very limited.
In a similar sort, thanks for the answer, thanks a lot. In a similar vein of things, when we had the last HOSC meeting, we had a Bob representative. I can't remember the lady's name. Perhaps we can furnish you with that name. But the question I asked was, you know, now that Bob is a much larger entity than just individual trusts on its own, would there be any possibility of strategic investment by Bob in certain specific areas? And the one I mentioned was the ED facility at Royal Berks. Bearing in mind it's not an ideal building and it's not an ideal capacity for the current number of patients going through ED. And this lady from Bob seemed to be saying that they would be looking strategically at the estate, and she intimated that there might be some budget to enhance, upgrade or something, RBHED. You know, and I was trying to emphasise Steve's point, you know, the staff are doing an amazing job, but the buildings are not the right buildings, and that's particularly true of ED. So I don't know if we can furnish the name of that person.
It was Hannah Mills that we talked to last meeting. We also talked about the Public Work and Loans Board.
You know, the kind of response we got from Hannah Mills was, I would say, shocked me in that, you know, they seem to be taking a more grown-up and strategic view of things rather than just saying, there's no money, there's no money.
So, Adrian, there are often small kind of short-term measure pots of money targeted at things like ED, targeted at things like cancer or diagnostics, which we look to access those funds all the time. But those, what that's resulted in, as you say, is a real patchwork of our facilities, with lots of little bits added on here and there. And I think we're reaching the point of both not having the space to do those small additions in, but also it's the rest of the hospital and the infrastructure that sits behind it that's causing, that causes our case for a whole new investment. But we do and we continue to look out for those opportunities to invest where we can. But a lot of that is about investing to stand still with the need of the population at the moment.
Thanks again for the answer, and I completely understand your perspective, and it makes sense. But I was just trying to articulate that the residents in our locality have a crumbling piece of infrastructure called RBH, and I was trying to emphasise that Bob need to look at it. But thanks a lot for the answers.
Yeah, I agree. Thanks, Adrian.
Thank you, Adrian. We do know that Clive Jones, one of our local MPs, has been pushing hard and meeting with both ministers and staff at the hospital, and he's doing his best to push it as much as he can. Can I ask a question, please, about working hours and what regulations you follow about working hours for staff, medical, both doctors and nursing staff? Are there any minimum and maximum regulations?
I'd have to defer to our Chief People Officer to get you the specifics on that, Chair. We are obviously bound by the working time directives on maximum hours in the same way as other professions are, and then there'll be guidance from the individual professional bodies as well, which we will adhere to in our practice with our staff. I think those mainly will be on the maximum end, although I suspect a number of our professions will require people to maintain a minimum amount of practice to maintain their licence and their registration.
Thank you. It'd be interesting if you could come back to us when you're able.
Yeah.
Thank you.
Thank you. There's a note in evaluation against the existing trust strategy about progress being slower in areas including resource sharing. And I just wondered if you could expand so I can understand a bit more about what that means, resource sharing.
Yeah, thank you. So that section, I believe, is where we're talking about, we've mapped out all of the ambitions from the current strategy and how far we've come. So partnership working is one of our 5 strategic objectives, delivering partnership. And we've made some good progress there. But at maybe the harder end of partnerships where we're sharing resources like staff or estate, we're maybe not as far ahead as we would like to be. That's where that's talking to. So we're doing lots of working together across patient pathways, but maybe we don't have shared teams of staff that we thought that we probably would at that point.
Could you give me a specific example?
Yeah, well, so there could be lots of different things that we could share with our partners. That might be something in our corporate services or our non-clinical services, perhaps sharing a people function or finance functions, IT, digital, across different organisations to achieve economies of scale. Or that could be teams that we share with other organisations, maybe health organisations. We've got some shared roles in elderly care with Berkshire Healthcare Foundation Trust, and it would be great if we could have more things like that help to streamline patient services.
Are there any resources that you would like to share with, or you would like working in Borough Council to share with you?
Ooh, that's a good question that I don't think I've got an answer for. I don't know if there's anything that Andy would like to add about how we work with local councils.
Yeah, so I think as we work together on what neighbourhood teams look like, I think there's a big area of collaboration in that space, both around roles, but also around facilities that we could make use of for joint teams to be working in, and then we're going to have to look hard at infrastructure and data sharing in that space as well. But I think neighbourhood teams and the area of prevention and well-being in general is going to be a really important area for us both to be working together on.
Is it all right if I say something on that? Because obviously we do share, for instance, some of the patients who come out of hospital, there's joint funding and things like that. Not always easy to work out whose is what, but we do share things like that and how they come out of hospital, the funding available, what resources are put into them. So we do share in that way as well. And sometimes it could be a better sharing, but we probably think one way and you might think another way. So, but we try and work together as far as possible.
Any more questions? No? Thank you very much. It's nice to see you again, and next time we see you will be towards dark nights and winter. I don't like to say that now, but thank you very much. Enjoy the rest of your evening.
Yeah. Thank you, Chair.
Thank you.
Oh, sorry, Alice, you didn't hear me. Nice to see you. It's your turn now on the agenda. You're next. Sorry you're not with us in person, but it's good to see you anyway.
Well, the reason for that, if I reach out my arm, I've got a blood pressure machine going every half an hour.
Don't tell us you've been to the hospital.
Yes, I am. So it goes every half an hour. It's quite nerve-wracking to be, yeah. So if I do stop, it's not that there is anything wrong. It's just my blood pressure machine goes off. But anyway, good evening, everyone. Thank you, Chair, for having HealthWatch for working. So I have shared with you all the report for June 2025. Our activities are more or less the same as such because we are trying to look at what is the impact. So the themes that we are having so far being heard by HealthWatch is GP access, not able to get appointments, trying to not able to use the digital platform, and also the struggle with system alert, whereby vulnerable groups like carers, learning disability, young carers highlight that this is an issue. So that has got an impact on their support and the GP services. However, we've highlighted this to the ICB and they are really working hard on that. But the feedback we are getting is also there are some groups that are not keen to identify themselves. So we were working with some of the carers partnership especially, and also council. I think council's also looking at it at the moment as well. So we are doing a collaborative work to try and make that access easier for the cohorts, and and find out why they are not keen to be identified. So it's called self-identification. So we are looking at that at the moment. Apart from that, more or less, our activities are the same. So we've added on one more activity. When we come to primary care, we also look at GP access, pharmacy, dentistry, but we're also now looking at opticians as well, which not many people think about, especially those with long-term conditions. What is their experience of using opticians? The Women's Hub is still a conversation that's still going on, which public health is also involved in that conversation, and I'm sure Jyoti will update you. But we are having conversations with the Integrated Care Board to try and see whether we can find a solution for Berkshire West. So that's still happening. The women's South Asian Women's Report is still the same. It's coming out soon, with the fact that we are going to be looking at community connectors working with the communities, especially communities like the Bangladeshi and Pakistani community, which has got high health inequalities, to look at health literacy. Apart from that, there is nothing new that I can share, unless there's anyone who's got anything to ask me from the report.
Thank you, Alice. Can I just say, in a couple of places in the report, you've got the reports will hopefully be presented to HOSC if required. I don't think you need to put the if required bit in. I think we would like to see the reports that you're doing. And could you let us know the date of the Women's Health Hub?
Yeah,
So that
I mean, we are looking at October. So, so that's, but we are scoping at the moment venues. So, but before that, a survey is going to be going out to all the women in Wokingham to find out what is their experience of women's health, and and how we can get it better. Is it community related? Would a community hub be a good platform for them? So that'll be coming out soon, kind of thing. We're just waiting for I'm just waiting for my annual report to be published, and then I'll be free. And also the launch as well. The launch has got bigger as well. So we are really excited. This is the first time we are having this launch, but also we also have with us this time the chair of the Bob ICB attending as well.
Thanks, Alice. Any questions? Alison.
Hello, Alice.
Hi.
Could you tell us more about the Language Matters project? Because I know you said you were hoping that you'd get responses to your letters by the 17th of March. I hope you have had lots of responses.
I mean, I haven't had much responses because I think in Wokingham there is this perception that language is not a problem. However, the Language Matters recommendation has gone to national, and NHS England has just published their framework for community languages, and some of our recommendations are already there. And I'm happy to share that report because it's only just come out. It came out on the 27th of May.
So is that something you're going to continue Health Watch work on?
Oh yeah, oh yeah. I mean, I think a lot of the time that the perception is there's no issue in Wokingham, but now we found out based on the South Asian women, I think it's not necessarily translation is the issue, but it's health literacy. It's the language that people use in the health world or the social care world that people don't understand. So this is something that we are trying to address. But it won't go away because I do think that we need to find out a little bit more and improve the translation services, because at Royal Berkshire Hospital, for example, they are working on a project called Words on Wheels, whereby interpreters are coming virtually and speaking to the client a lot quicker than asking a translator to travel. So that's something that they are trying to pilot, and I'm hoping to hear their results soon. But I mean, this is all will be fed back on the 10th of September because we are hosting another event called of Language Matters to feed back to the public about what has taken place a year later.
Any more questions for Alice? You got away lightly tonight, Alice.
I think the blood pressure machine has been sympathetic.
We just don't want to send your blood pressure up too high.
Well, I don't think so. It's just because of that kind of. But thank you,
No,
thank
I'm
you.
sure it
But
isn't.
I mean, please
but we're
do
looking
reach out.
after you as well.
I know, but please do reach out if there is any questions, because I mean, I think in a lot of ways, collaborative working is the one thing that I'm very, very keen on so that we don't have duplication.
Lovely. Thank you very much. Nice to see you.
Thank you.
That's the end of our formal meeting. We've now got the forward programme.
Could you update us on the need for the 2nd of July meeting and whether we're having it or not?
I don't, but I will ask Madeline to contact you with an update.
Yes. Jyoti, are you aware of another meeting in early July? We've got one in the diary.
I might have seen something. Let me just check my inbox to see if I can give you an answer. I'll come back to you in a second.
Okay, thank you. We'll let you look at your inbox and we'll carry on. Okay. Any questions on agenda item 10?
Yeah, the forward plan. I've got one question, which was when we had the Reading Coroner's Service in last time, they gave some, I would say, evasive answers concerning non-invasive autopsies, and I promised Shahid Yunus that I'd follow up on that, and this is me following on. But basically, I think we need to have the Reading Coroner's Service back, and for them to present their current situation in terms of how many autopsies are invasive, non-invasive, etc. Because I believe there was additional funding somewhere, I believe it was in West Berkshire, for additional scanning technology. So hopefully in West Berkshire there is more scanning technology, because at the last coroner's meeting, Berkshire was last in the country in terms of percentage of non-invasive autopsies, which wasn't a great place to be, and I want to see that improving. So I don't know whether this is the right time for them to come back with their KPIs, but I'd like to see them.
We'll follow that up.
Well, we do have that on our list of unscheduled topics. And are we aiming to schedule all of these topics into the programme tonight?
Sorry, did you hear me then?
Yes.
Oh, thank you. So could you...
Okay, so we're not going to... We can't really do anything else tonight on item 10 then?
Not tonight, no, but we'll speak about it. Neil? Okay, thank you. Jyoti, sorry.
That's okay. I can answer or make some attempt to answer the last question as well. There is a meeting scheduled for the 16th of July with an agenda. It's on should be in your papers. So
it is. Yeah,
so I think that the plan is to go ahead with that. With regards to the coroner, I have been in touch with the person who commissions the coroner, who sits in Reading. He's undertaking a review of the service and has suggested he comes back when that review is complete, which I think will be sometime in July. So probably if he scheduled in for the one after July, that would work.
So that'll be September or something.
Yes.
Yeah.
Yeah, our July one's probably too early for him.
I think so, yeah.
We have got one pencilled in for the 2nd of July. It's not on here. That's the one that Alison was asking about.
So I would assume that there isn't one on the 2nd of July, but there is one on the 16th of July. Yeah.
There is an email saying it's no longer required.
Oh, thanks, Rebecca.
It is likely that we will no longer require an extraordinary HOSC meeting on the 2nd of July. That was on the 30th of May.
That's on Friday.
Yeah. Yeah.
Any more questions on the forward plan? No? No? That, I believe, brings us to the end of the meeting. Thank you very much. Thank you, everyone. I'll now close the meeting. It's lovely to go home in the daylight.